Dear expectant mother, because of medical issues, a Caesarean section is indicated, or it is your personal wish. In both cases, it is necessary that your physician provides you detailed, objective information about possible consequences and risks of the procedure. To make it more illustrative, the next minutes will show you the most important aspects of the Caesarean. It should ease your decision whether you prefer a Caesarean or a vaginal birth, as long as there are no other medical issues. A Caesarean section is also called C-section. A variety of medical conditions can support the election of a Caesarean. That may be abnormal position of the fetus, for example breech or transverse presentation, disproportion between the mother's pelvis and the fetus size, placenta before the uterine orifice, insufficient function of the placenta, stagnation of the birth process, or a change of fetal heartbeat during a vaginal birth that may harm the child, as well as certain diseases of the unborn or the mother. The mother's psychological condition may be another reason. For a painless intervention, various methods of anesthesia can be used. In very rare cases, the procedure is performed under a general anesthesia. Usually, you receive a regional anesthetic from the pelvis downwards. Peridural anesthesia, spinal anesthesia, or a combination of both. You are not by yourself. During all kinds of anesthesia, specialized medical staff will be present in the delivery room. You may be in a sitting position or in a lateral position lying on one side. After disinfection of your back, the skin is infiltrated with a local anesthetic to numb the actual puncture side. The anesthetist places a hollow needle in an anatomical gap between the bony spinous processes. It is then placed in the epidural space. Compared to spinal anesthesia, the drug is not injected into the cerebrospinal fluid. After placement of the tip of the hollow needle into the epidural space, the catheter is threaded through the needle. Then the medication is injected. You will feel the warmth spreading through your body and your legs will start feeling heavy and numb. Even days after the Caesarean, drugs may be applied over the catheter to manage pain. Your anesthetist will inform you about possible risks of the different methods. In rare cases, side effects as back pain or headache may occur. These can be treated with medication. Voiding dysfunction can make a urinary catheter necessary temporarily. Permanent paralysis is as good as excluded because the spinal cord ends above the injection side. Following the anesthesia, you will be helped lying comfortably on the back. Since it is surgery, very strict hygiene is essential. Your body will be washed with a disinfectant solution and will be covered in sterile sheets. First of all, the surgeon marks the skin for the transverse incision, just below the bikini line. In most cases, it is barely visible. After that, step by step the skin layers and abdominal cavity are opened, either by a sharp or blunt dissection, with or without the use of a scalpel. The Miskav-Ladach method is meant to be very well tolerated and effective. The tissue is only being distended and not cut to support a better healing. You only experience a shaking. As soon as the uterus is opened, the child can be born. Up to that point, only a few minutes have passed. Right after the umbilical cord is cut, the pediatrician will take care of your newborn. For example, amniotic fluid will be aspirated from the respiratory tract, or the vital functions will be checked. Afterwards, a midwife brings you your little one. Congratulations! The surgeon removes the placenta as well as possible remains from inside the uterus, and then sutures the different layers carefully. Nowadays, post-surgical pain is very much reduced, and vaginal birth after caesarean is frequently possible. If, against all expectations, serious complications should occur, the physician will make an individual medical decision. Due to prior examinations, they can sometimes be expected. If, for example, severe blood loss occurs, a surgical removal of the uterus may be necessary. After surgery, the surgeon and the medical team will lift you in your bed. The entire caesarean takes about 30 to 60 minutes. For a few hours, you will be monitored in the delivery room or post-anesthesia care unit, and then you will finally be transferred to the ward. No surgery is without risks, but knowledge and experience of your medical team and modern methods can minimize the risk of complications. For your child, there are no higher risks compared to a vaginal birth. Very rarely, the child has smaller cuts. These heal most likely without complications. If you had a general anesthesia, the newborn may be sleepy and therefore the spontaneous breathing may be delayed. For you, as expectant mother, normally the associated risks are very low. Your doctor will inform you in detail. Theoretically possible risks are injury of organs as blood vessels, urinary bladder, bowel or stomach, severe bleeding, even days after the procedure, infections that can be treated with antibiotics, dysfunction of the uterine tubes, bowel obstruction after a temporary paralysis of the gut, vascular obstruction or occlusion, damage of soft tissue, nerves or skin, abnormal sensation in the area of the scar. Vaginal birth after caesarean is generally possible. Anyhow, women with at least one previous caesarean have a higher risk of an abnormal placental position. For example, the placenta can be located before the uterine orifice or infiltrate the uterine wall. In such cases, after birth, the removal of the uterus may be necessary. Mostly caesarean section and vaginal birth have only one result: healthy children and happy mothers. Your medical staff wishes you joy and delight with your precious.